Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking to you about CMS proposed rule for fiscal year 2023 hospital inpatient and long-term care hospital quality reporting programs. Let's dive right in. The Hospital Inpatient Quality Reporting Program is a pay-for-reporting quality program that reduces payment to hospitals that fail to meet program requirements. Hospitals that do not submit quality data or fail to meet all hospital inpatient quality reporting program requirements are subject to a 1/4 reduction in their annual payment update under the Inpatient Prospective Payment System. In the fiscal year 2023 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System proposed rule, CMS is proposing to adopt 10 measures, refine 2 current measures, make changes to the existing ECQM reporting and submission requirements, remove the zero denominator declaration and case threshold exemptions for hybrid measures, propose updates to our ECQM validation requirements for medical record requests, and propose reporting and submission requirements for patient-reported outcome-based performance measures or PRO-PMs. CMS is also requesting comment on the potential future adoption of 2 Centers for Disease Control and Prevention's National Healthcare Safety Network or NHSN measures. Specifically, CMS is proposing to adopt Hospital Commitment to Health Equity measure beginning with the calendar year 2023 reporting period / fiscal year 2025 payment determination. CMS is also proposing to adopt screening for social drivers of health measure and screen positive rate for social drivers of health measure beginning with voluntary reporting in the calendar year 2023 reporting period and mandatory reporting beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is also proposing to adopt 2 perinatal electronic clinical quality measures, cesarean birth and severe obstetric complications available for self-selection beginning with the calendar year 2023 reporting period / fiscal year 2025 payment determination, followed by mandatory reporting beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is also proposing to adopt hospital harm, opioid-related adverse events, electronic clinical quality measure, which is also National Quality Forum measure number 3501E, beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. Another proposal is to adopt the Global Malnutrition Composite Score electronic clinical quality measure, which is also National Quality Forum measure number 3592E, beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is also proposing to adopt hospital-level total hip arthroplasty or THA and / or total knee arthroplasty or TKA PRO-PM, which is also National Quality Forum number 3559, beginning with 2 voluntary reporting periods, July 1st of 2023 through June 30th, 2024, and July 1st, 2024 through June 30th, 2025, followed by mandatory reporting for the reporting period, which runs from July 1st, 2025 through June 30th, 2026, impacting the fiscal year 2028 payment determination. CMS is proposing to adopt hospital-level risk standardized complication rate or RSCR following elective primary total hip arthroplasty / total knee arthroplasty measure, which is also National Quality Forum number 1550, beginning with the fiscal year 2024 payment determination. Another proposal is to adopt Medicare spending per beneficiary hospital measure, which is also National Quality Forum number 2158, beginning with the fiscal year 2024 payment determination. CMS is also proposing refinements to two measures that are currently part of the hospital inpatient quality reporting program measure set, beginning with the fiscal year 2024 payment determination. And the two measures are hospital level risk standardized payment associated with an episode of care for primary elective total hip arthroplasty and slash or total knee arthroplasty, which is also National Quality Forum measure number 3474. And the other one is access days in acute care or EDAC after hospitalization for acute myocardial infarction, which is also National Quality Forum measure number 2881. CMS is requesting comment on the potential future inclusion of two digital NHSN measures. They are Healthcare Associated Clostridioides Difficile Infection Outcome Measure and Hospital Onset Bacteremia and Fungemia Outcome Measure. Additionally, CMS is proposing two updates to their policies related to electronic clinical quality measures. First, CMS is proposing to modify the electronic clinical quality measure validation policy to increase the submission requirement from 75% to 100% of the requested medical records to successfully complete electronic clinical quality measure validation beginning with the fiscal year 2025 payment determination. Second, CMS is proposing to modify the electronic clinical quality measure reporting and submission requirements to increase ECQM reporting from 4 ECQMs, 1 mandatory and 3 self-selected, to 6 ECQMs, 3 mandatory and 3 self-selected, beginning with the calendar year 2024 reporting period / fiscal year 2026 payment determination. CMS is also proposing to remove the zero denominator declarations and case threshold exemptions policies for hybrid measures beginning with the fiscal year 2026 payment determination. Lastly, CMS is proposing submission and reporting requirements for pro-PM measures beginning with the fiscal year 2026 payment determination, specifically for the proposed total hip arthroplasty / total knee arthroplasty pro-PM, since this is a new measure type for the hospital inpatient quality reporting program. Medicare Promoting Interoperability Program. In 2011, CMS established the Medicare and Medicaid EHR incentive programs, now known as the Promoting Interoperability Programs for eligible hospitals and critical access hospitals or CAHs, to encourage eligible professionals, eligible hospitals, and critical access hospitals to adopt, implement, upgrade, and demonstrate meaningful use of certified EHR technology. CMS specifically is proposing the following changes to the Medicare Promoting Interoperability Program for eligible hospitals and critical access hospitals. Make mandatory the electronic prescribing objectives query of Prescription Drug Monitoring Program or PDMP measure. Expand to include Schedule 2, 3, and 4 drugs and maintain the associated points at 10 points. Add a new enabling exchange under the Trusted Exchange Framework and Common Agreement or TEFCA measure under the Health Information Exchange or HIE objective as a yes/no attestation measure beginning with the EHR reporting period in calendar year 2023 as an optional alternative to the 3 existing measures under the HIE objective. Add a new antimicrobial use and resistance or AUR surveillance measure and require its reporting under the Public Health and Clinical Data Exchange objective beginning with the calendar year 2023 EHR reporting period. Beginning with the calendar year 2023 EHR reporting period, CMS is proposing to reduce the active engagement options for the Public Health and Clinical Data Exchange objective from 3 to 2 options. Beginning with the calendar year 2023 EHR reporting period, CMS is proposing to require submission of the level of active engagement in addition to submitting the measures for the Public Health and Clinical Data Exchange objectives. Institute public reporting of certain Medicare Promoting Interoperability Program data beginning with the calendar year 2023 EHR reporting period. beginning with calendar year 2023 EHR reporting period. CMS is proposing to increase the public health and clinical data exchange objective from 10 to 25 points, to increase the points associated with the electronic prescribing objective from 10 to 20, to reduce the points associated with the health information exchange objective from the current 40 points to 30 points, and to reduce the points associated with the provide patients electronic access to their health information from the current 40 to 25 points. Adopt 2 new electronic clinical quality measures to the Medicare Promoting Interoperability Program's electronic clinical quality measure set, beginning with the reporting period in calendar year 2023, and 2 new electronic clinical quality measures beginning with the reporting period in calendar year 2024, in alignment with proposals for the hospital inpatient quality reporting program. Modify the electronic clinical quality measure reporting and submission requirements to increase ECQM reporting from 4 ECQMs, 1 mandatory and 3 self-selected, to 6 ECQMs, 3 mandatory and 3 self-selected, beginning with the calendar year 2024 reporting period, in alignment with proposals in the hospital inpatient quality reporting program. PPS exempt cancer hospital quality reporting, or PCHUR program. The PCHUR program is a voluntary quality reporting program for the 11 cancer hospitals that are statutorily exempt from the inpatient prospective payment system. CMS collects and publishes data from PCHs on applicable quality measures. In the fiscal year 2023 inpatient prospective payment system / long-term care hospital prospective payment system proposed rule, CMS is proposing to begin public display of the 30-day unplanned readmissions for cancer patients measure, or PCH 36, and the 4 end-of-life measures, which are PCH 32, 33, 34, and 35. CMS is also proposing to adopt and codify a patient safety exception into the measure removal policy. CMS is requesting information from stakeholders on the potential future adoption of 2 digital National Healthcare Safety Network, or NHSN measures, the NHSN Healthcare Associated Clostridioides difficile infection outcome measure, and NHSN Hospital Onset Bacteremia and Fungemia outcome measure. Long-Term Care Hospital Quality Reporting Program, or LTCHQRP. The LTCHQRP is a pay-for-reporting program. Long-term care hospitals that do not meet reporting requirements are subject to a 2 percentage point reduction in their annual increase factor. In the fiscal year 2023 Inpatient Prospective Payment System / long-term care hospital PPS proposed rule, CMS is requesting information on inclusion of the National Healthcare Safety Network, or NHSN Healthcare Associated Clostridioides difficile infection outcome measure in the long-term care hospital quality reporting program request for information, or RFI. CMS is also seeking stakeholder feedback on the inclusion of a digital Centers for Disease Control and Prevention, or CDC NHSN Healthcare Associated Clostridioides difficile infection outcome measure into the long-term care hospital quality reporting program. This measure tracks the development of new Clostridioides difficile infection among patients already admitted to long-term care hospitals using algorithmic determinations from data sources widely available in electronic health records. This measure improves on the original measure by requiring both microbiologic evidence of C. difficile in stool and evidence of antimicrobial treatment. Through this RFI, CMS would like to assess the feasibility of this digital measure in long-term care hospitals. If this type of measure is proposed and finalized in a future rule, this would be the first digital measure in the long-term care hospital quality reporting program. CMS is also requesting information on their overarching principles for measuring healthcare disparities across CMS quality programs, including the long-term care hospital quality reporting program, as well as quality measure concepts under consideration for future years. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Bye now.